Surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at JointRehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752, right here in the studio at 866-870-5752. And you want to check out Dr. Darrow's website, lots and lots of information there at www.lastemcells.com. That's www.lastemcells.com. And you can also see him performing these treatments on videos, as well as emailing him off of every page on the site. Now, if you've been listening for a while and you're ready to call the office and make an appointment, that number is 800-300-9300. That's 800-300-9300. We are here Saturdays at 10 a.m. and again at 1 p.m. And what else do you have going around at the office? You have something else going on, Dr. Darrow.
Yeah, we do what's called the vampire facelift for people that don't want the knife for their face to look good. We actually take your cells from your body. We can use your platelets or stem cells and inject those into the face. And as we age, we start to dry out. So does the face, and the fat starts to decrease. So it's a way of plumping up the face pretty instantaneously and making people look more beautiful. So that's an amazing thing. It's for cosmetics, but it's the same idea as I do for musculoskeletal pain, arthritis, joint pain, ligament pain, tendon pain, all over the body. There's really nowhere in the body that I don't inject on the musculoskeletal system, from the back of the head all the way to the neck, shoulders, elbows, wrist, fingers, hips, knees, ankles, plantar fasciitis on the bottom of the feet, the toes, you name it. But this vampire facelift, I don't think you're going to forget that name. It's a great name.
It's a great name.
Is amazing for looking good simply by getting injections that regrow the tissue in the face. So this is Dr. Marc Darrow, and I was just talking before the break about a patient that I had drive up from San Diego yesterday, a wonderful young man who had surgery that I thought was a little bit different. I'd never seen it before. He had a labral tear in his hip, and as I was mentioning before the break, the labrum is fibrocartilage that surrounds the ball of the femur, the upper, the thigh bone, where it articulates with the pelvis, what we call the acetabulum. It's like a cup in the pelvis, and then the femur comes in and articulates or interfaces with that. And so for his labral tear, they thought it'd be a great idea to do an osteotomy of his femur. They actually cut the bone to, honestly, I don't know why. I can't imagine why, but that's what was done. And they thought there'd be less stress on the joint. So he had that done, major surgery. And for labral tear, give me a break, because we take care of labral tears by a quick injection. You walk in, you get an injection. It's got to be under ultrasound guidance to even see that labrum, because it's so teeny. And then they walk out afterwards. But at any rate, this person had this major surgery for the labral tear. And then, guess what?
What?
Any idea, Anita? Another surgery afterwards.
Failed.
Because the first one failed. There you go. That's the word, failed. So he's here to see me now to fix it using regenerative medicine, which is, in my point of view, and it's just me, I don't run the world,
You don't?
But I run my little world.
Oh, okay. That's good.
Not the big world. And I don't ever put other doctors down because everybody's got their point of view. And my point of view, if you're going to be doing anything with the doctor, do the most conservative thing you can, not the most invasive. So fixing a labral tear, the way to do it in my book is inject it. Okay? Inject it, you take a little needle, you put it in there, you inject it, and the person walks out. And I say this all day long, be sure you're using a doctor that understands and knows how to use an ultrasound so he can watch where that needle's going. Hitting a labrum is not easy. It's a teeny little speck. You've got to be able to see it under magnification of an ultrasound. Look inside the body and see it. So ultrasound is really needed for knees and shoulders and hips. So at any rate, these are the kind of things I see all the time. Now, we don't even know whether this gentleman's pain was caused by his labral tear. When we do studies of people's hips that have zero pain, okay, we say, how many people have no pain? And the people with no pain raise their hands, and we do an MRI or ultrasound. They have labral tears often. So do we ever really know what is generating pain? Do you know the answer to that, Nita?
Well, you can touch the area and oftentimes figure it out, but I wouldn't say that you every time know exactly. Sometimes
That's
you
right.
don't know.
That's right. And unfortunately, what we call traditional medicine is based on injecting steroids, which is terrible for the tissue. It breaks it down. Doing surgery from looking at MRIs or X-rays when we don't even know if that's causing the pain. And you folks who have listened to me for a long time know we've talked about this over and over and over. There are people that get surgeries when the doctor never even touched them. He slaps up an MRI or an X-ray and goes, look at that. That's terrible. You've got a meniscal tear in your knee. Oh, that's so terrible. Well, we treat meniscal tears all day long and get people better. How could that be? We're not cutting anybody. We don't cut. We inject. We inject with cells that stimulate your body to regenerate itself. Doesn't that make more sense? It certainly does for me.
It made sense for me.
That's right. We
You
did
treated
your neck
me.
about,
That was like 16, 17 years ago already.
That's when you were like 10 years old, right?
Well, 11, but you're close.
Yeah, I mean, we got to be conservative in medicine. We don't go for the cannon to kill a mosquito, right?
Right.
We want to be very conservative. We want to do things that are not going to hurt people. And doing regenerative medicine with platelets, called PRP, or stem cells, is a very simple, conservative way to go. And I'm very lucky I, quote, fell into it. And I'm very lucky that I can do it on most parts of my body that I've injured. And I just injected my knee a week ago. I'm ready to go play golf.
Well, you're very active in the sports world, so that is an inspiration to those people in pain that you have had injuries and that you have got through your injuries by treating it with regenerative medicine. So people listening that are active in sports, or perhaps not right now because you're in pain, give us a call. Tell Dr. Darrow what's going on. There may be a much simpler solution than you can imagine. Our number here at the studio is 866-870-5752. That's 866-870-5752. Lines are open for you right now.
You know, Nita, you're crackling up on my line. I don't know what's going on, but let's have Alex take a peek at that.
Okay.
I have another question here that's on a different subject, but it's one that men and women suffer from all the time. and it's about hair loss. So hair loss has to do with many different things. There are what we call diseases that can cause it. Many times it's just hormonal in nature, where a person's DHT, that's dihydrotestosterone, is too high. And what a lot of people use for that is something called Propecia, which blocks the DHT. If we have someone using Propecia or finasteride, we have to be very careful to make sure that their bone mass is not depleted. Because when you drop down the DHT, the bones stop remodeling. Okay, so we have to be very careful. We do in the office inject the scalp with PRP or stem cells to grow hair. In my book, in the back of it, there's a chapter about that with the research. So yes, it is possible to regrow hair, and it's something that we do quite a bit of at the office. If you're interested in that, you can call, which is our office number, 800-300-9300. I'll repeat it. Grab your pencil, 800-300-9300. And if you're interested in talking to me right now about that, the phone number to the studio, live and local, is 866-870-5752. And I'll repeat that number. It's 866-870-5752. And it's a very simple procedure. You walk in, we put some numbing cream on the scalp, and then we use a very teeny needle, a 30-gauge needle, and inject little blebs of your cells, platelets or stem cells, into the area. And it's an amazing procedure. You can, if you want to email me, you can go to the website, which is www.lastemcells.com. That's lastemcells.com. Go to that website. Every page has a spot to email me, and I will send you before and after photos of a person's scalp, and you can see what it can do theoretically for you. We do have a caller here, Jerry, which I'd like to talk to about your knee. Jerry, Dr. Marc Darrow, how long has your knee bothered you for?
Yeah, this is Gary.
Okay.
Dr. Mark, my name's Gary, not Jerry.
Oh, Gary, I apologize.
Yeah. You know, I went into your office, and I did see you, and you did treat me.
Okay.
But I don't think it didn't turn out so well.
Okay.
I know you wanted to treat me again, do another treatment, but at $2,800 a shot, you know, it's kind of expensive for me.
Okay.
So it basically, though, it failed, your treatment, because I was in so much pain afterwards. You know,
Sure.
I was trying to do my job, trying to work. I'm a mechanic, and it was very, very difficult for me, especially the week after following.
Sure. Okay.
But,
so the pain wasn't there after the injection. It was a week afterwards?
Yeah, it was there, but it wasn't at the time that you treated me. My knee wasn't bothering me too much, but now it clicks all the time when I walk, and it didn't do that before.
Okay.
But anyways, you know, it's not that I don't believe stem cell is a good procedure. I know it's a good procedure because I had my right knee done by a different doctor. But he, you know, a little bit different technique than yours.
Okay.
Because he used my own.
So can I explain a few things to you, Gary?
Sure.
Okay. You're a great example for people to listen to. Not everybody is healed by one stem cell. Actually, it's pretty rare, to be honest with you. Do you know what your pathology was in your knee?
As far as what was wrong with my knee, you mean?
Yeah. Did you have an MRI?
Not on my left, no.
Okay.
And you didn't require it when I went to see you.
Okay. First treatment, we don't require it. If it didn't work, we would get it then. But there's many things that can happen. Number one,
Yes.
As I said, and as you knew when you came in to the office, you actually signed something saying, number one, there's no guarantees. Number two, that it could take several treatments.
What? There's no guarantees in life? I'm amazed.
Shocking.
Well, yeah. I mean, I'll tell you what happened many, many years ago. I did a woman's back, and she healed up for about 9 months or so. And then she called me up, literally yelling at me, saying, you promised me this would last forever. So I then added...
a pretty long time, though.
Well, I mean, theoretically, when we do these treatments, we're growing new tissue, and it should last unless you beat it up.
Yeah,
Okay.
but you know, I wish you had...
May I talk, sir? Gary, can I talk? You've had plenty to say, and I need to respond to it. Otherwise, we have to cut you off the radio.
Okay, go, you go.
Thank you. So, number one...
By the way, I really like you. I think you're a great...
Well, I like you, too. I don't know who you are, but I like you. So, we're going to cut Gary off because he likes to keep talking, and I need to respond.
Okay, listen up, Gary. Okay.
So, Gary, please listen to all of this. So, many people will come in for a treatment, platelets or stem cells. They don't get healed on the first treatment, and they're not expected to. So they can go somewhere else and get healed, and then they say, yours didn't work, the other doctor's better than you. But they needed more than one treatment to begin with, okay? And I don't know if Gary really was a patient or not, or he's just here to pick fun at me and the show. It's fine with me. You're not hurting my feelings, Gary. We get the same thing on Yelp where people make up these fake reviews. But the point is, not every treatment's going to work. It sometimes takes more than one. It sometimes takes several. I was talking about my shoulder earlier in the show. The first injury I had was one treatment for complete healing for a dozen years. The second injury was a different injury. That took 2 treatments. The third injury, which was many years later, and I've been doing this stuff on myself for 22 years, took me a few months of treatments to heal it. It was a very bad injury. So we make sure we talk to everybody. I spend as much time with patients as they would like. Sometimes I spend an hour explaining this with patients, that we have no idea whether it will work or will not work. And the typical failures are when a person is active, when they sign something with me. They sign a consent that says they are not going to exercise or go back to work until they call me and I give them authority to. Now, this person went back to work fairly immediately, and then I know that what I did not cause the pain that he has, because if there is pain from an injection, it's going to happen immediately after the procedure of the regenerative medicine. If we caused something like a synovitis, which is an inflammation of the cells that produce fluid, that person will get some fluid in the joint. We get them in right away, we aspirate it, we take the fluid out, and they are fine. So this person had pain a week later, they'd gone back to work, they didn't listen to me. You don't want to listen to me, that's fine. And I tell people that's fine. You want to cheat on me, go ahead. But you're going to get the results that you create. Okay? So I'm not trying to defend myself here. I'm just giving you information. So not everybody's going to heal. Everybody knows that. There's no guarantees. But most people that listen will heal if they follow the procedures. Typically, I'm going to inject every couple of weeks so that the inflammation can stay there, so we can draw, or what we call sequester, more fibroblasts to the area. They are cells that produce collagen, which is the major constituent of cartilage. In the knee, we're trying to grow back as much cartilage as we can. So, at any rate, we have Dan waiting on the phone. You have a question about Parkinson's, which is not my field, but I will take your question, Dan, and we'll see what I know about it. Do you have Parkinson's?
Hi, Dan. Are you there?
Yes. I was wondering if these stem cell treatments can be used to treat Parkinson's.
The answer is yes, but it's not something that I do. My practice is limited to musculoskeletal pain, not neurological issues like Parkinson's. Parkinson's is a process in what we call the substantia nigra, which is a part of the brain in the back that deals with movement. And when the cells die, we have movement disorders. Very often, there are Parkinsonian syndromes that are not really Parkinson's. And I've seen it in many cases with people that take anti-cholesterol drugs like Lipitor. Have you taken that?
Many years ago, I took it, and when I started having calf pains, I stopped taking it.
Okay.
My whole family has genetically high cholesterol.
Okay.
And so doctors always go crazy when they see my cholesterol numbers. But
okay.
My mom has...
So Nita and Alex, I'm getting a lot of crackling on the line, and I can't hear Dan, so let's please take him off and see if we can get that
Sorry,
handled.
Dan, we're having technical difficulty, but we appreciate your call.
Yeah, Nita, I hear it from you too, so it wasn't Dan. So Dan, at any rate, there are things that can be done to help you, and if you want to go to my website, www.lastemcells.com, that's lastemcells.com, and email me. I will either give you the information that I have, or I will put you in touch with a doctor that can help you. There are many doctors that are not on the radar. They're not traditional doctors that deal with Parkinson's disease or Parkinsonian syndrome, and some of them have to do with high-dose antioxidants. I'm trying to think of the doctor that wrote the book on this, and it's not coming to mind, but I can look him up very quickly and fire you back an email or give you a call if you want to go to my website, which is www.lastemcells.com. I will shoot you his name, and you can get in touch with them or other doctors that I know that do treat Parkinson's disease, or what I'm going to call Parkinsonian syndrome. And I think it's really most people that have the syndrome, not the disease, that have the problem. I have several patients that I've had that did take Lipitor like you did and ended up with tremors, even after they stopped. One of them actually put himself to sleep for good because he didn't want to live like that. And it was very sad case. He started Lipitor. I said, don't do it. There are many side effects to that drug. It's not a good drug. And most people that are on it don't need to be taking it. It lowers cholesterol, but most people do not need their cholesterol lowered. That is something that is done and taught by the drug companies. So be careful.
Okay,
so
well, we
Leslie,
have a little time
can we
left.
work with you? Boy, we're getting a lot of strange questions on a show about musculoskeletal medicine. So Leslie is calling in about, can you work with cellulite? It's not my thing, Leslie. This is Dr. Marc Darrow. I do orthopedic medicine. If you want to email me, just like I had Dan do, if you were listening, go to www.lastemcells.com. I can give you medicine on cellulite, but it's not what I do in my office. Do you have any more questions about that, Leslie?
Oh, am I on the air?
Not anymore. The show is over.
Sorry, Leslie.
Oh, okay,
Sorry, Leslie. Okay, you've been listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. Thanks for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.